From expectations to conversations, we offer all the services you would expect. HealthFirst Network provides quality, confidential reproductive health care, education, and nutrition counseling.
One of the questions I think a lot of people that are sexually active have is, how do you prevent having a sexually transmitted disease or infection? You know what? Since this is such a big topic, I need both of you guys here. Jesse Scharfenberg is the Chief Executive Officer of HealthFirst Network, and Justine Tickey is the Public Relations and Education Specialist. As I mentioned, STIs are scary. What can we do to prevent them?
I would say use a condom. That's the number one thing, is to use a condom. And we don't see individuals using condoms anymore.
Why is that?
So there's many reasons that people don't use condoms anymore. One thing is that we have really great access to birth control methods. So they know that if their partner is on a birth control method, there's no risk of pregnancy. So we kind of forget about the STI side of things and preventing those. The other aspect is we have some really great resources to prevent HIV. You can actually take medication that's prophylaxis so that you could have sexual intercourse with someone with HIV and not get HIV. So now that we're not worrying about preventing HIV as much because there's other medications that are working for that, people kind of forget about having to use a condom to prevent chlamydia and gonorrhea and herpes and warts because those aren't thought as long-term diseases or big consequence infections.
Here's a question. Are those still viable diseases?
Yes, we are seeing large numbers of chlamydia still occurring, gonorrhea. For the last 5 years, we have seen increases in STIs across the United States in all categories. So this isn't something that is even plateauing or that we're seeing going away by any means.
No, Justine, Jesse mentioned using condoms. Is that, as an educator, is that something you have to teach people how to do, how to use a condom?
Yes, absolutely. So when we go and do education for students, or we are doing outreach in the community, we make sure that we let folks know about condoms, how to use them, and we can provide demonstrations as well. So we're able to show how to use internal and external condoms, or more commonly known as male and female condoms.
Okay, you got me there. What is an internal condom?
So an internal condom is sometimes still known as a female condom, but that is a condom that can be used internally, as the name would imply. So that could be utilized in someone with a vagina. They would insert the condom internally, and it would provide protection that way. So you would use either the internal or external condom, but you would not use them both together. So you use one or the other. And then that internal condom can also provide some additional STI prevention externally. So when we're thinking of those STIs that can be spread through skin-to-skin contact, the internal condom can provide some additional protection by having some of that condom outside of the body as well.
Am I stupid for not knowing what those are?
No, but I feel that a lot of people don't know what they are. They're not commonly used. It's something that we encourage and we give out to all of our clients on a normal basis, is using that internal condom. It should be used. It should be widely known, but it's not. I think there's a lot of education that just focuses on the external or the male condom, and when education occurs, they just forget about the internal condom. The other great thing about the internal condom is that it can be used for anal sex as well and actually put into the anal cavity. So one thing that we talk about STI prevention, everybody's like, oh, penile to vaginal sex. Well, actually, you can get STIs in your mouth. You can get STIs in your anus. You can get it on your penis or in your vagina. So when we're talking about STI prevention, we're talking about if you're having oral sex, you should be wearing a condom.
I don't know how to follow that up.
That is why there are flavored condoms. So when Justine's providing education, we talk about that. There are flavored condoms. So if you're having oral sex and a penis is going into your mouth, that individual should be wearing a condom. There's also what we call dental dams, which are almost like a piece of plastic that would go over the vaginal area that an individual could put there or over the penis, just so that there's the protection from the skin-to-skin contact so that we're not transmitting infections between individuals.
Justine, do you offer both of these types of condoms at HealthFirst Network?
Yes, we have both of these in all of our clinics available for anyone who's looking for them. So people can pick these up regardless of sex. So again, as we said, for the internal and external condom.
With HealthFirst Networks, we've talked about STI prevention. What about if, you had unprotected sex and you're worried about, did I catch something or did something sneak by the condom or I got an itch or burn or, Is there testing available?
Yes, so we do testing for STIs, and just as you said, whether someone has had unprotected sex, and even if they've had protected sex, condoms work really, really great at preventing STIs, but since they aren't 100%, we do recommend getting screened routinely for STIs if you are sexually active. So at least once a year, everyone should be getting screened for STIs. And if you are having a change in partner, if you have multiple partners, then we would likely recommend getting screened more routinely. So you can talk with one of our providers, and then they would be able to let you know how frequently to be screened for that. At HealthFirst, we test for chlamydia, gonorrhea, syphilis, HPV, genital herpes, genital warts, trichomoniasis, or sometimes known as trick, and HIV.
Is there like a shot or a vaccine or something that somebody could take to prevent STIs?
There is a vaccine. It's called Gardasil, and it will protect you against 9 of the most common cancer-causing strains of HPV, which is the human papilloma virus. So what we see is that human papilloma virus is linked to oropharyngeal cancers, so neck and throat cancers, head cancers, and then we also see it linked to anal cancers and then cervical and vaginal cancers as well.
Now, this is something that's available to anybody up to the age of 45, right?
It is now licensed by the FDA for individuals up to 45 years of age, both male and female.
There's a lot of people out there that have cervical cancer that don't know that they have it or have the precancerous cells for cervical cancer, correct?
Yeah, that's very true. So that is why when individuals come in for their annual exams, they are on schedules to have their PAP done. And then we also do what's called HPV co-testing. So we're taking samples of the cervix to be looking for the HPV virus as well.
Is this part of the FPOS?
It is part of Family Planning Only Services, or FPOS. So the Gardasil vaccine, the annual exam, the PAP smear, the HPV co-testing, all of that is covered by FPOS. So individuals are getting these services at zero cost.
And where do we go about getting appointments?
You call 1-800-246-5743 in 9 counties in north central Wisconsin.
And it's free.
And it's free.
For more information, visit www.healthfirstnetwork.org or find us on social media at HealthFirst Network, Inc.